coronavirus, or at least since we found out that he was diagnosed with coronavirus, he's been ignoring CDC guidelines to isolate. He's been going into the West Wing, going into the Oval Office. He's been talking about how he wants to get back on the campaign trail, resume rallies. What's your reaction?
Well, it's unfortunate, but it's absolutely predictable. I mean, this is a president who has refused to follow public health guidelines, and unfortunately, he has encouraged others to ignore those same guidelines. I would say it's very predictable that sooner or later he was going to get infected, and his entire family and those closely around him are also going to get infected. So we're seeing what we would predict play out in real life.
Speaker Pelosi said today that the president is, quote, in an altered state right now, and suggested, quote, there may be some impairment of judgment due to the fact that not only does he have the virus, but he is on a medication, including a steroid that is known to have as a possible side effect effects on mood and irritability and judgment. Is she going too far? Do you think that he is in an altered state right now, potentially?
You know, what we're missing in this whole situation is transparency about really how sick the president is. We don't really have the truth about when he was infected, what stage of infection he's in. I don't think we know all of the various treatments he was given and what combination and what dosage. And so I would say anything's possible at this time. I don't think she's going too far. I think she has every right to be concerned about his behavior, about his response, and about his recovery, because we just don't know the truth yet.
It's true. They have not been transparent. They've been opaque. Why does it matter?
It matters because it's a message for America. It's a message for people around the world. We need to know what is wrong with our president. We need to know how sick he is, and we need to know what type of treatments he's getting so we can learn from that so other people will be able to follow the right example. Planet to do the things he's doing this soon after knowing they're infected. And we wouldn't want someone up out of the hospital bed with these types of experimental therapies right now. So he's leading with a very bad example for the entire world, actually.
And how dangerous could that be theoretically? I mean, he is surrounded by, frankly, not a lot of guardrails. The people like General Kelly and General Mattis and others have long gone. And I don't know that he has anyone in his orbit who can tell him no, frankly. What does it mean if he's not thinking rationally because of the medication he's on?
It's very dangerous. He's in charge of a lot of things and makes a lot of important decisions for our country and for the world, actually. And if he's not in the right sound mind to make those decisions rationally, then he can be very reckless for our country and for the world.
There are at least now 20 people in the president's orbit who are infected with COVID. That's as many as we know about. There might be more. We still don't know, as you alluded to, we still don't know when he last tested negative, meaning we really don't have an idea of when he first contracted the disease. The only explanation I can think of as to why they keep stonewalling on this very basic question, when did he last test negative, which gives us an idea of when he caught the virus, is that the answer is actually worse than the spectacle of the continued stonewalling. What do you think?
Jake, that's the same behavior we've seen from this president since the start of the outbreak. He has never told us the truth about the risk or the seriousness of this outbreak. He's not told us the truth about his status or when he was infected. You're right. When you hide the truth and you're not transparent, you're hiding something much worse. And by hiding that, by lying to the American public and not telling us the full truth, you're actually prolonging the duration and the impact of this pandemic. You're actually allowing more people to die.
You say it's time for more scientists and more medical professionals, such as yourself, to lay your careers on the line and push back against how the president is handling this pandemic, as you did. Explain more what you mean by that and who you're talking about.
Jake, there are so many career scientists in our government healthcare system, and these are the best scientists in the world. I mean, I would put the expertise and the experience and the judgment of the scientists we have, the CDC and the FDA and the NIH and at BARDA, all throughout our government, up next to or against anyone on the planet, and our scientists are going to shine. They are concerned about this White House and this administration overruling the best scientific judgment. They are concerned about the political pressure that has been put on them to change a course of behavior, a course of action, or to rewrite science, or come up with some fake science and then put it forward as the truth. So they're very frustrated. I hear from my colleagues across our government, in the healthcare system especially, who are very frustrated. They're concerned that the truth isn't getting out. They're concerned that the best guidance and practices aren't being heard. And they're concerned about the lack of leadership, leading by example and encouraging people to follow those guidelines. So their frustration is because by blocking this information, by holding back their best evidence and their best guidance, then it is leading to more infections. It's leading to more hospitalizations. We have 30,000 people in our country right now in the hospital from COVID-19. More people are going to die because scientists are being pushed back. Scientists are not being heard. And I'm trying to speak up and encourage others like me in our medical field, in our scientific field, to speak up, because Americans need to know the truth. The world needs to know the truth. And if we continue to hide the truth, then we're going to see many more deaths that don't need to occur.
What is the truth that you're talking about that they're being prevented from saying?
This is a deadly pandemic. This is a deadly virus. The messaging that President Trump gave to America and the world when he left the hospital about there is no need to be afraid of this virus is probably the most reckless, deadly piece of information I have ever heard. This virus is deadly. It is airborne. And now finally the CDC is being allowed by the White House to tell the world it is airborne. It spreads person to person very easily. Look at the hot spot from that Rose Garden ceremony for the Supreme Court nominee. That one situation, how many people are now infected from that one situation? That's an example for America to see how quickly and easily this virus can spread from person to person. What they're not seeing is the number of people then that they go on to infect, the number of those people that go into the hospital, and then all we're seeing is some tallies, some numbers. And the numbers have a way of hiding the true feelings and life and the emotion, the family, the names of the people that are dying from this virus. The truth is, this is deadly. The truth is, there are things that we can and should be doing to reduce the risk, to slow the spread, to protect our healthcare workers, to protect each other, and to save lives. And the White House refuses to tell people the truth about those measures and their impact.
And you also talk about the politicization of this, the pressure on the scientific agencies to, for instance, when you filed your whistleblower report, it was about earlier this year, you were objecting to the fact that you were being pushed to act as if hydroxychloroquine was a cure-all, was a reasonable therapeutic, when in actuality, at the very least, it is not proven to be that way, and at the very worst, it could actually hurt people.
It's shameful what is happening from the White House, from this president and his senior administration officials in pushing unproven drugs forward as a panacea, as a miracle cure, as a cure-all, as a gift from God, all the ways that they describe these treatments without any evidence behind them. And pushing them forward, encouraging free, wide access to Americans, in some cases where Americans didn't even need to be diagnosed with COVID-19. Knowing that these drugs could cause significant harm, these drugs could cause death even, it's reckless for the president and his administration to promote these. They're not scientists. They're not medical professionals. They're not healthcare professionals. The scientists know the truth, and their voice has been silenced. That is shameful from this White House.
Stay right there. We're going to come back to you. I want to ask you about the unproven